Bismillahirrahmanirrahim. Assalamu alaikum, everyone. And this is our second lecture about the biopharmaceutics and the pharmacokinetics. In this lecture, we will discuss some of the pharmacological terms that are used in pharmacokinetics. These include the first one that is called as the potency, then efficacy, therapeutic index, and the therapeutic window. So let's begin with the first term that is called as the potency. Potency is related to the dose. It is related to the amount of drug. So this is the called as the amount of drug that is needed to produce 50% of the maximal effect. It is called as the potency. And potency of any drug, it depends upon the affinity of the receptor with the drugs. The drugs that have the high potency, they will have the high affinity with the receptor, and the less potent drugs, they have less affinity with the receptor. So here the graded dose response curve for four drugs it is shown, and we have drug B, drug A, drug C, and drug D. Although the drug A, C, and D they have the same efficacy, but the drug B is more potent because the amount of drug that is required to produce 50% of its maximal effect, it is less as compared to drug A and C. So this is in the figure you can see that the B drug, this is the maximal response that the drug B it can produce, and its 50% response will be around here, and this will be the dose. So you can see that less dose is required for the 50% response. But if you see the drug A, the 50% response of the drug B will be somewhere around here, and the amount of drug that will produce 50% of the response will be somewhere here. So this amount of the drug A, it is higher as compared to the drug B. Similarly, you can see that the drug C, it is less potent as compared to A and B. If you see the 50% the response, that could be around, you can say here, and the amount of the drug C that is required to produce 50% of the response, it will be somewhere around at this level. So you can see that the amount of drug that is required to produce 50% of the response, it is more as compared to A and B. So the drug C, it is less potent as compared to drug B and the A. And similarly, we can say that the drug D, that is you can say it is the at the end. This is the drug C. If you see, this is the maximal response that is produced by drug D. If we consider its 50% response, that will be somewhere here, and the amount of the drug D that will produce 50% of its effect, or 50% of its maximal effect, that will be somewhere here, and the amount that will produce the 50% of the effect, it will be more as compared to drug B, A, and C. That's why we can say that the drug D, it is less potent as compared to drug B, A, and C. So I'm just for your clarification, I am just putting here that this is will the 50% response by the you can say the drug D, and if this is the 50% response going down, so going down means we have to touch the amount, and it will be somewhere here. So this will be the, you can say, the 50% response that is the produced by the drug D. So altogether, we can say that efficacy-wise, A, C, and D, their efficacy is almost all equal. But the maximal effect that the drug B can produce, although it is less, but the drug B, it is more potent as compared to A, C, and D. So taken together, we can say that the drug B is more potent than going to drug A, then C and D, and finally the drug D, it is less potent as compared to other drugs. So potency is related to the dose of drug. This figure again, it shows the two drugs, the one drug that is called as the drug A and other drug that is called as the drug B. So the drug B, it is less potent as compared to drug A. So in this figure you can see that this is the amount of drug B that produce 50% of the response, that is more as compared to drug A that will produce 50% of the response at this level. So the drug A, it is more potent as compared to drug B, and in this figure you can also see the drug A, it is more potent as compared to drug B. So potency taken together, it is related with the amount of drug that produce 50% of the maximal response. So here you can see that this is the 50% of the maximal response that a drug can produce. So the other term that we use in pharmacokinetics, that sometime when we are discussing about the efficacy of the drugs, these terms come again and again, and I think it is the best time to get clear concept of the efficacy. It is the maximal response a drug can produce. So in the previous figure you can see that if I go there, the drug A, C, and D, almost all they have same efficacy, and drug B has less efficacy. But drug B is more potent as compared to other drugs. So the efficacy is basically related to the effect of drug, to the response of drug, and we have full agonist, we have partial agonist, we have antagonist. The full agonist, they have maximal efficacy. The partial agonist, although they occupy the receptor, but their efficacy is less as compared to the, you can say, the full agonist. So the partial agonist, they have less efficacy. The full agonist, they have more efficacy. They bind with the receptor, and the antagonist, they bind with the receptor, but their efficacy is zero. So that's why we can say that the antagonist, when they bind with the receptor, basically they prevent the binding of the natural mediator, or the agonist with the receptor, or they prevent the binding of the drug at its receptor site. So the antagonist on their own, their efficacy is equal to zero. The full agonist, they have more efficacy, and the partial agonist, they have less efficacy as compared to the full agonist. And for us, for the pharmacist and for the medical students, the efficacy is more important as compared to the potency. So we are always concerned with the efficacy of the drug. So it is basically the effect that is discussed in case of efficacy. So this is the figure. You can see that we have three drugs: drug A, drug B, and then we have the drug C. Drug A, it is, you can say, this is the maximal response that drug A produce. This is the drug A. This is the drug A. This is the drug B, and this is the, again, the drug. You can say the C. The drug A and the drug B, almost all their efficacy is the same, but the drug C has got less efficacy as compared to drug A and the drug B. Drug A is more potent because less dose of this drug it is required to produce 50% of the response. So again, efficacy could be discussed over here. And drug B, it is less potent as compared to drug A, and again the drug C, it is less potent as compared to drug A and drug B. So drug C, it is least potent as compared to A and B, and efficacy wise the drug C, it has less efficacy. If you see the maximal response for the drug C, it is less as compared to the drug A and B. So the efficacy of A and B, it is almost all equal. You can say from this curve, इनकी curve जो है, it is almost all equal. but in case of drug C, the curve is going down, so its efficacy is less as compared to drug A and drug B. Okay. So the another term that is called as the related to efficacy, that is called as the quantal dose response, and this is the all and none response, that is called as the binary drug effect. Sometimes we give the drug and we have the binary effect, means that you will have two types of response, all or none principle. So like we have the headache or we don't have the headache, we have the convulsion, we don't have the convulsion, we have the arrhythmias, we don't have the arrhythmias. So it is based on you can say all our non-response. It is the binary in nature, and it is basically measured in population, showing the presence or absence of any response. Here you can see that the this is a quantal dose response curve. So we will explain in the further slides this quantal dose response. So it measures the effect in the population. And ED50, we discussed the ED50, we discussed the TD50, and we discussed the LD50 in case of quantal dose response curve. The ED50 is the effective dose in 50% of the population. If the dose is producing its effect in 50% of the population, that is called as the median effective dose. Then we use the term median toxic dose. This is the dose that produces specific toxicity in 50% of the population. Then we use the median lethal dose. This is the dose that produces death in 50% of the population. So if a drug has a lower ED50, it means the drug is more potent as compared to the drug that has increased ED50, because effective dose is high, so that's why drug is the less potent. So if a drug has ED50 of 5 milligram, it means the drug is more potent as compared to another drug that has 500 milligram of ED50. So that drug has the less potency. So potency is linked with the you can say the amount of drug, and efficacy is really associated with the effect of drug. So the ratio between the TD50 and the or LD50 over ED50, it is called as the therapeutic index. So we classify the therapeutic define the classic therapeutic index as the ratio between LD50 over ED50 or TD50 over ED50. If any drug has got the therapeutic index that is close to 1, it means that the drug is very toxic. And if the drug has got high therapeutic index more than 100, then it means the drug is safer in nature. So the therapeutic index, which is the ratio between LD50 over the ED50, it represents the safety of the drug. A drug with the high therapeutic index, they are safe as compared to the drugs that have low therapeutic index. They are toxic as compared to the drugs that have the high therapeutic index. So this is the list of some drugs that have the low therapeutic index, means the ratio is very small, and any drug can have the therapeutic index more than 1, or it could be maximally we can go up to 1. It cannot be less than 1, because it is the ratio between LD50 and the ED50. That's why the digoxin, it is very you can say the potent, as well as it is very toxic drug. Another is propranolol, morphine. They have low therapeutic index. They are less safe as compared to those drugs such as diazepam, sulfonamides, chlorpropam, promazine. These drugs, they have got high therapeutic index. So moving to the next slide, which is called okay. So this is basically that represents the therapeutic index of the drug. Here you can see that the drug produces ET50, that is 100 milligram, and the LD50 for that drug that produces the death, I mean in 50% of the population, which is 400 milligram. So 400 milligram divided by the 100 milligram. If we divide all together, we will have the 4. So 4 is the therapeutic index for that drug. So this is the mathematical proof how to calculate the therapeutic index. Again, if the therapeutic index is small, drug is toxic. If the therapeutic index is large, drug is safer in nature. So moving to the next slide, which is called as the therapeutic window. Therapeutic window is different from therapeutic index, and the therapeutic index basically indicates the safety and the efficacy, or you can say the toxicity of the drug. Therapeutic window is the range between minimum effective dose and the minimum toxic dose. So if this is the minimum effective dose of the drug, and this is the minimum toxic dose, this range is called as the therapeutic window. So therapeutic window, it is the range between the minimum effective dose to the minimum toxic dose. So here you can see that this is the therapeutic window for the drug that is very small, and the drug is warfarin, which is anticoagulant in nature. So this is the here you can see that this represents the therapeutic window of the warfarin, which is very small. Here in this case, you can see the therapeutic window for the penicillin, that is large as compared to the therapeutic window for warfarin. So the penicillin, they have large therapeutic index as compared to the warfarin, which has got the low therapeutic index. Here you can see, if from here the effect of penicillin starts, and at this level the drug produce the death in 50% of the population. So range is high as compared to the warfarin. The range is very small, so it is very toxic. I mean the warfarin. So again, this slide also shows the in case of pharmacokinetics, this is the minimum effective concentration, and this is the minimum that is the toxic concentration that produces the toxic effect, or minimum effective concentration for the adverse effect. And this range between MEC and MTC, that is called a minimum toxic concentration, or we can say it MEC for adverse effect. This range of the concentration between MEC and MTC, it is called as the therapeutic therapeutic window. So altogether today we discuss some of the pharmacological terms that are associated with biopharmaceutics and the pharmacokinetics. These include efficacy, which is related to effect of drug, and we discuss the potency, which is related to the dose of drug. Then we discuss about the therapeutic index, which is the ratio between LD 50 over ET 50. And then we discuss about the therapeutic window, which is basically the range between MTC and the MEC. This is basically the concentration range between MTC and MEC. So with this, I will conclude our lecture today. And if you have any suggestion, you have any comment, or you have any question, you can ask in the comment section. Thank you.